Have you ever experienced that jolt of terror? The moment when your heart begins to hammer, flutter, or skips wildly in your chest. It hits without warning, perhaps while you're asleep, or just reading a book. Instantly, you're swept up in a wave of panic. The fear is primal. Am I having a cardiac emergency? Am I losing control of my body? This feeling of utter helplessness is one of the most distressing symptoms of an irregular heartbeat. Most people believe that once the heart has spun out of control, they are powerless. They think only a doctor, emergency medication, or a defibrillator can intervene. But that belief, widely held, is a scientific misconception. The truth, established by decades of cardiology research, is that your body has an innate, built-in neural mechanism. It is your heart's emergency brake. It's called the vagus nerve. Today, we are going to show you 3 scientifically proven non-invasive maneuvers. These are the exact vagal maneuvers that medical professionals use to immediately stop acute episodes of a fast or irregular heart rhythm. By learning these 3 techniques, you are given the ticket to autonomy. You will transform that moment of frightening panic into a moment of controlled, informed, and immediate action. This knowledge is your shield. The vagal brake, your heart's neural override system. To effectively apply this emergency brake, you must first understand the engine itself. Your heart rate and rhythm are governed by the autonomic nervous system. This system is a constant tug of war between 2 powerful and opposing forces. Think of it as the central control panel of your entire body. The sympathetic nervous system is the gas pedal. This is your ancient evolutionary fight-or-flight response. When your body senses stress, anxiety, or an acute arrhythmia begins, this system is triggered. It floods your circulatory system with stress hormones, primarily adrenaline and norepinephrine. These hormones instruct your heart to accelerate, to beat harder and faster, causing that pounding, rushing sensation. The parasympathetic nervous system, or PNS, is the brake pedal. Its most critical component, and our focus today, is the vagus nerve. The vagus nerve is the 10th cranial nerve. It is the longest and most complex nerve in the human body. It functions as a superhighway, delivering information from your brainstem down to nearly every major organ, including your throat, lungs, stomach, and colon. Critically, the right branch of the vagus nerve innervates the sinoatrial node, or the SA node. The SA node is the heart's natural pacemaker. When we manually activate the vagus nerve, we are forcing it to release a powerful neurotransmitter called acetylcholine. Acetylcholine is the chemical signal that instructs the SA node to slow down. It dramatically reduces the speed of electrical conduction in the heart. In essence, vagal maneuvers allow you to interrupt the sympathetic system's acceleration by applying a powerful, immediate parasympathetic brake. This is the core science behind regaining control. Technique 1. The Valsalva Maneuver, the push protocol. The Valsalva Maneuver is the most widely studied and safest non-pharmacological treatment for stable supraventricular tachycardia, or SVT. SVT is the fast heart rhythm that originates in the upper chambers of the heart. The maneuver's effectiveness relies on creating a sudden and temporary change in blood flow and pressure. The 4 phases of the Valsalva Maneuver. For optimal results, we must aim for clinical precision, though we are performing the standard home version. Phase 1. Initial pressure. Begin by taking a normal, deep breath. The patient should be seated or lying down to maximize the blood pressure changes. This positioning prepares the circulatory system for the imminent hemodynamic shift. Phase 2. The strain. Close your mouth, and without exhaling, you must push or strain forcefully. Imagine you're trying to exhale against a blocked airway. or as if you are straining during a difficult bowel movement. You are creating a high-pressure environment inside your chest. This high intrathoracic and intra-abdominal pressure temporarily compresses the large veins. Due to this compression, the blood flow returning to your heart, venous return, temporarily decreases. The key is to maintain this forceful strain for a full 15 seconds. This is the parameter scientists have verified for optimal vagal stimulation to interrupt the rhythm. Phase 3. Release. Immediately after the 15 seconds are complete, you must stop straining and relax completely. Take a slow, normal breath. Do not hold your breath during this release. This sudden action causes the intrathoracic pressure to drop rapidly back to normal levels. As pressure drops, the blood that was trapped rushes back into the heart and the large blood vessels at a high rate. Phase 4. The overshoot, the vagal response. The critical moment of the maneuver lies here. This sudden influx of blood causes a rapid, transient spike in blood pressure, known as the overshoot. The baroreceptors, which are pressure sensors in your arteries, detect this sudden rise. They immediately signal the vagus nerve to counteract this pressure jump. The vagus nerve responds by firing that powerful acetylcholine brake signal to the heart's SA node. This is the moment the abnormal heart rhythm is interrupted and, hopefully, converted back to a normal sinus rhythm. A critical caveat: while safe and essential as a first-line response, clinical research shows that the standard unmodified Valsalva maneuver performed at home has an efficacy rate of only about 5 to 20%. Do not repeat this maneuver endlessly if the episode persists. If it fails, you must move to the next technique or seek medical attention. Technique 2. The Diving Reflex, cold water shock. The second technique taps into one of the most powerful and primitive survival mechanisms in all mammals: the diving reflex. This reflex is your body's instinctive, evolutionary response to conserve oxygen and energy when submerged in cold water. When properly activated, it forces an immediate, drastic slowing of the heart rate, even in the face of tachycardia. The immediate objective is not simply cold, it is to shock a specific set of facial nerves to trigger a massive neural response. Step 1. Preparation. You must prepare a bowl of water that is as cold as you can safely make it. For maximum effectiveness, the water temperature should be around 10 degrees Celsius or 50 degrees Fahrenheit by adding a generous amount of ice. The colder the water, the stronger the vagal stimulation and the more pronounced the slowing effect. Step 2. The immersion protocol. Take a deep breath and hold it. The breath hold is a vital component of this reflex. While holding your breath, immediately and completely plunge your face into the ice-cold water. It is essential that the water covers the area below your eyes and the bridge of your nose. This area is rich with the critical sensory receptors we need to activate. Hold your face submerged for 10 to 15 seconds, or for as long as you can safely tolerate the intense cold. Step 3. The alternative and safety. If you are not at home or cannot submerge your face, you can use a bag of ice or a cold, wet cloth. Place it firmly over your eyes and the bridge of your nose for the same 10 to 15 second duration. Never submerge your head into water alone if you're experiencing severe symptoms or are at risk of losing consciousness. The science behind the shock. The trigeminal nerve. The cold water instantly stimulates the sensory receptors of the trigeminal nerve, or cranial nerve 5. This nerve is extremely sensitive to temperature and wetness in the nasal and facial regions. The trigeminal nerve relays this acute sensory shock signal directly to the brainstem. This signal bypasses the usual stress response and instantly activates the vagus nerve, The vagus nerve's response is to instruct the heart to slow down, bradycardia, and constrict peripheral blood vessels. This is the evolutionary mechanism designed to conserve oxygen and redirect blood flow to vital organs like the brain and heart during a dive. It is extremely effective at interrupting abnormal cardiac electrical pathways and restoring a stable rhythm. Technique 3. The instant interrupt and absolute warning. We now address two rapid maneuvers. One is safe but limited. The other is potentially dangerous and requires medical supervision. The forceful cough, a momentary fix only. In moments of a sudden, alarming heart flutter, a series of deep, forceful coughs can sometimes help. The mechanism is essentially the same as a mini Valsalva. The cough creates a rapid, brusque pressure spike in your chest. This brief interruption can sometimes be enough to knock the heart back into a normal rhythm by disrupting the abnormal electrical circuit. How to perform it? Cough vigorously, multiple times, as if you're trying to expel a large obstruction from your throat. The critical safety note. The American Heart Association strongly emphasizes that this is not a substitute for CPR. The technique's only proven utility is momentary maintenance of blood flow to the brain, and it is primarily used in monitored clinical settings, such as a cardiac catheterization lab, until definitive medical treatment is ready. It is a temporary measure only. It cannot fix most complex or chaotic heart rhythms. Do not delay calling emergency services by coughing repeatedly if symptoms persist. Carotid sinus massage, the absolute warning. The carotid sinus massage is a highly effective vagal maneuver used to treat tachycardia, but due to its inherent risks, we must state this with maximum clarity. This technique should never be performed by yourself or any layperson at home. It must only be performed by a trained medical professional or under direct medical supervision. The carotid sinus is a highly sensitive area located in the neck where the carotid artery divides. This location is rich with baroreceptors, which are pressure sensors that, when stimulated, immediately signal the vagus nerve to slow the heart. Manipulation can cause a sudden, severe drop in heart rate, leading to fainting, syncope, or even a temporary cessation of the heartbeat, asystole. The most significant danger, especially in our target audience, is the risk of dislodging plaque. In older individuals or those with arterial hardening, massaging the carotid artery can break free a chunk of plaque. This plaque can travel to the brain, causing an immediate stroke. Absolute contraindications: do not attempt. Do not, under any circumstances, attempt this if you or the individual have any history of 1. A heart attack, myocardial infarction, or stroke, cerebrovascular accident, within the last 3 months. This is a non-negotiable rule. 2. Any known blockage or artery hardening, which is often indicated by a whizzing sound called a carotid brew heard through a stethoscope. 3. A history of serious ventricular arrhythmias, such as ventricular tachycardia or ventricular fibrillation. The potential for catastrophic risk is too high. Trust the medical professionals with this specific tool. Conclusion: regaining autonomy and your next step. We have now unlocked the 3 key, evidence-based techniques to instant heart palpitations relief by engaging your vagus nerve. 1. The Valsalva Maneuver, the controlled 15-second pressure push. 2. The Diving Reflex, the ancient, evolutionary cold water shock. 3. The Forceful Cough, the momentary interrupt. These are powerful tools that give you immediate autonomy to control fast heartbeat during a frightening episode. Remember this core thesis. Your body possesses an ancient, powerful neural emergency brake, the vagus nerve, And learning these simple, non-invasive maneuvers allows you to instantly regain control of a racing heart, turning panic into power. This knowledge allows you to take a breath, reduce your anxiety, and intervene on your own behalf. The critical medical disclaimer. This content is for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider or cardiologist before attempting any new maneuver or making changes to your health regimen. If your heart palpitations are frequent, worsening, or occur alongside severe chest pain, fainting, or shortness of breath, seek emergency medical attention immediately. Do not hesitate. Now for our resonance point. Which of these 3 emergency stops are you most likely to practice before your next episode? Let us know which one you found most calming in the comments below. But what if we could shift our focus entirely from emergency response to daily prevention? The key to long-term heart rhythm stability is not just a quick fix. It is strengthening the vagus nerve's daily function through simple lifestyle choices, starting with nutrition. Next, watch our video on the 5 foods that feed your vagus nerve to build a powerful daily shield for your heart. We are committed to helping you find peace of mind through the power of science and self-empowerment.